Superstar Celine Dion is one of the top singers in the world, but now she's in the spotlight for a very personal struggle. She is living with a rare condition called stiff person syndrome. Her struggles are being featured in a new documentary that came out just yesterday. And here to tell us more about this rare disorder is Dr. Suzie Bash, a neuroradiologist with RadNet. And thanks so much for joining us. This is so rare, most of us haven't heard about it. So tell us, what is stiff person's disease?
Sure. So stiff person syndrome, or SPS, is a rare neurologic disorder that has features of autoimmune disease. And an autoimmune disease is when your own immune system mistakenly attacks normal healthy cells in your body. And the disorder can manifest as fluctuating episodes of muscle rigidity and stiffness and spasms throughout the body. And it's also associated with hypersensitivity to certain stimuli, like a loud noise or touch, or a rapid motion, cold temperatures, or even emotional stress. And then those stimuli can trigger severe debilitating spasms that can be quite painful and even result in a fall. So patients with SPS often have difficulty with motion and walking. And in Celine Dion's case, it actually could unfortunately impact her ability to sing, because if it impacts the muscles of phonation, like the facial muscles, palate muscles, tongue, laryngeal muscles, and the diaphragm. And actually in the documentary, which I just saw yesterday, she mentioned that the change in her voice was the first symptom she ever had about 17 years ago of stiff person syndrome. She noticed a slightly higher pitch in her voice due to spasm of those laryngeal muscles.
Interesting. Now, you know, there's no real cause. There's things that trigger stiffness perhaps, but there's no cause of the actual condition?
Well, actually, we think that the cause, in most cases, is related to an antibody against an enzyme in our body called GAD. And so it's an anti-GAD antibody. Now, GAD prevents our nerves from overstimulating our muscles. So when you have antibodies that block the GAD, you lose that inhibitory response, and you end up with, you know, sort of increased motor rigidity and spasms that you see in this disease. And so it's a hyperactive muscles. And so again, can be very debilitating, but we do think in most cases it's related to this antibody against the GAD enzyme. And that can actually be tested for with a simple blood test.
And so many of us are only just now hearing about this disease with Celine Dion. Why haven't we heard about it? Is it a new condition, or?
Yeah, so it's not a new condition, but it's extremely rare. And I think that's why most people really weren't aware of it before, because it's 1 in a million.
Wow.
So extremely rare. It affects women 2 to 3 times more common than men. But when you think about it, the symptoms that you get with muscle rigidity and spasms can be seen in other diagnoses that are much more common. So like Parkinson's is 1 in 1,000. Ankylosing spondylitis is 1 in 1,000. Multiple sclerosis is 1 in 750. So when patients come in with this, it's SPS is probably not the first thing that you think about. But, you know, if the patient does have those classic symptoms, and then on clinical exam, if they have sort of rigid board-like muscles, then that might, you know, raise your awareness to testing for the GAD antibody. And there are other tests you can do as well. You can test the muscles and see if you have a lot of motor firing. So there's other things as well. But again, it is a simple blood test that is often done to make the diagnosis along with your clinical exam.
Really, just one blood test? Wow.
Yes.
Okay. All right. Well, doctor, thank you so much for joining us. We certainly appreciate your time and really bringing some insight into this condition that most of us hadn't heard about before. So thank you. And of course, you can find more information about Dr. Suzie Bash and stiff person syndrome by going to kcalnews.com and clicking Seen on TV.